I'm not new to the SOGC. I spent many years on the finance committee, then transitioned to being treasurer, and then ultimately into being president-elect. This has allowed me to gradually familiarize myself with the governance of our society. I've also had the chance to work more closely with our CEO, Jenny Blake, and the staff in the office in Ottawa. And I'm looking forward to seeing what we can accomplish together over the next year. How did it all start? Je suis née à Montréal et j'ai fait mes études de médecin à McGill avant de déménager à Nouvelle-Écosse avec mon mari. Looking back on that first day as a clerk at St. Mary's Hospital in Montreal, I was taken under the wing of the chief resident and did a delivery within moments of arriving on the labor ward. I was immediately hooked. And then was lucky enough to have the late professor, Dr. Robert Kinch, arrange an elective for me in Glasgow as a medical student. Here, I saw my first young girl who was brought in by the flying squad fitting. That experience demonstrated both the critical care and the joys in our specialty. I did my residency at Dalhousie and had the privilege of working with John Collins, Tom Baskett, and actually our next president-elect, Tony Armson. Those teachers are who shaped you. I then practiced in Halifax for 7 years and moved to Toronto and have been at North York General with my good colleagues for 25 years. As I take over as president, there is a lot to do in the coming months, both within our society and in the health policy arena. We've all heard the interesting news this week about the impact of the upcoming legalization of cannabis, what effect this will have on pregnant women. Many cannabis dispensaries regularly recommend marijuana to pregnant women as a safe product for hyperemesis. Clearly, we have an educational job ahead of us in Canada over this next year to correct this fallacy with the data that we do have on the effect of cannabis on the developing brain. Another passion of mine is to examine what we, particularly as OBGYNs, can do to promote less opioid usage for our patients. At our hospital, we have a program in conjunction with our anesthetic colleagues to reduce postoperative usage and increase patient awareness. This program has been endorsed by the pharmacists and is being expanded across all of the surgical programs at the hospital. The SOGC is also working to develop a strategy for implementation of identification, measurement, and some type of national surveillance system for maternal mortality and morbidity in Canada. This is crucial because currently it's the missing piece of the puzzle since we don't have data from all the provinces and northern territories. While Canada does have a comparatively low rate of maternal mortality, recent reports suggest that there has been a slight increase. We're dealing with different things. We're dealing with new and aggressive bacteria, mental health concerns, substance abuse, and interpersonal violence. The working definition currently really doesn't capture all these kinds of cases. And in the absence of a national strategy, it's difficult to conduct standardized investigations and reduce preventable deaths, and I know this has been close to Michael's heart. The other significant work that Michael's been doing is to try to enhance perinatal safety in birthing suites and reduce the incidence of perinatal death and hypoxic injury. I fully support this and will try to push this forward during the next year. I'm also interested in trying to promote some kind of more uniform national standards, any type of national definitions, including antenatal forms, genetic testing, and most importantly, definitions of levels of care for facilities that provide maternity care. We need to examine the quality of care that we are providing, and we need to involve the women themselves in the decisions. I think we can provide a better level of care. This can be further improved on a national basis, and I have been struggling with updating the old 2000 version of the policy statement, attendance at labor. 1/5 of Canada's population lives in rural communities, and it is critical to be able to serve these communities. Unfortunately, many of those smaller locations are undergoing attrition, and there are currently some programs to train rural physicians in enhanced surgical skills and anesthesia. So we really need to develop training models and provide more support for those rural areas. And I feel this is an important part of my mandate. Other ongoing programs that I and we endorse are the Choosing Wisely, led by George Carson, the ERAS surgical program, which most places have now adopted. As president, I am excited to also be part of the Academic Council, the newly formed council, and this will increase the academic voice of the SOGC and provide improved reproductive research and health-based care for our population. Education is very important, and outside of our CME events such as this, we must continue ongoing education at the hospital level and support the importance of skills drills at each unit. These type of events are fundamental to ensure that all team members are equally involved and skilled in reacting to any emergency. We need to keep growing the membership and convince our learners and residents of the value of joining our society. Nous allons continuer notre discussion avec l'Association des obstétriciens puis gynécologues du Québec pour améliorer le contenu francophone de nos conférences, la qualité de traduction de nos directives cliniques, les avis du comité et les bulletins techniques. And during my presidential year, as you've been hearing, we're having a big birthday party. The SOGC turns 75 in May of 2019. So we're starting to look at events to commemorate this important milestone, both looking back but also looking towards the future. So quality of care, education, advocacy, and growing stronger are the 4 pillars of our society. And I believe that my goals and the ongoing work of the SOGC blend well into these pillars. I wholeheartedly accept the challenges before me and before all of us. Finally, I'd like once again to thank Jenny Blake, a friend, a mentor, and a leader of this great organization. She has taken us in positive directions since she took over at the helm. She started as CEO while I was treasurer, and we have weathered some difficult times together. I'm very proud to stand beside her as we move forward in 2018. I must also thank my husband, Dr. David Cole, who helped me write my PhD thesis, helped me study during medical school, and has put up with my call schedule for over 30 years and is still by my side. My children told me that despite my crazy call schedule, I was always there for them, and they are here for me. Je suis très fière d'avoir l'opportunité d'être votre présidente et d'avoir la chance de travailler de l'Est à l'Ouest dans notre pays. Merci beaucoup. Thank you very much. Muchas gracias.